Greetings. Today we're speaking about Ehler Danlos Syndrome. Ehler Danlos Syndrome, or EDS for short, is defined as a group of connective tissue disorders that are inherited. And not only that, but it can also develop and get acquired during your lifetime due to spontaneous mutations. As in, you are going to be the first person to have this abnormality in your genes, and thus you're going to pass it down to your descendants instead of having it inherited from your parents at the beginning. And it is subdivided into 13 different groups, all of which share 3 specific characteristics. They are more prevalent in some subtypes more than others, yet they are still present, which are the hyperextensibility of the skin and hypermobility of the joints and the tissue abnormalities. As you may see here in this exhibit, the hypermobility of the finger joints and the hyperextensibility of the skin. It was first discovered and discussed and described by the 2 doctors, Edward Ehlers and Henry Alexander Danlos, who in the first decade of the previous century started having some patients come in who had these identical symptoms: extensibility, hypermobility, and so on. And on this slide, you may see that there are about 13 to be exact. And today we're going to be talking about the classic hypermobility, vascular kyphoscoliosis, and arthrochalasia, and dermatosparaxis. The other forms, yes, they are very important to know about, but we're mainly going to be focusing on these 7 if you count type 1 and 2 separately. Now, EDS is caused by disorders or mutations in different genes, each of which specifically is going to decide which subtypes of EDS the patient is going to have or have to deal with. And in some variants, the gene mutations affects the connective tissue matrix or the CT matrix proteins, which are the proteins responsible for giving strength to the body and forming the basis and foundation of the ligaments, bones, tendons, muscles, and skin. And they all rely on collagen for their strength. The issue with protein molecules in this case is going to be that it is going to be altered by the mutation, leading to its weakening. This syndrome causes people to lose balance while maintaining or performing simple actions, such as holding lightweight objects or walking. And that is due to the instability of the joints. And even though the person becomes more flexible, the cost is going to be his balance, which normal people don't have any problems with. It can also lead to straining or dislocation of the joints due to how flexible it becomes. And as a form of coping or helping, in this case, resistance training is being done at early ages as early as it's discovered to compensate for this hypotonia. And some of the following symptoms may be more prevalent in some subtypes than others, but they are still mentioned there. Bone deep pain, frequent joint dislocations, which is very common in the type 3 hypermobile type, skin problems including dermatorexis or cutaneous fragility, and it is causing splitting of the dermis or the mucosa that are mainly under the pressure points, be it the elbow or the shoulders, and sometimes the knees. And Areas prone to the trauma, such as the chin, or the forehead. And as you get a trauma, if you are affected by this case and you get a minor trauma, let's say you get hit by a small stone, the scar going to be formed is not going to be a simple bruise. It's going to be a burn-like scar post minor traumas or any kind of trauma that you may experience. Now, classical EDS. In this type 1 and type 2 are spoken as two together due to the similarities between the two. Let's begin with type 1. Type 1 is a collagen disorder, which is also called gravis or severe, and it is estimated to be 1 in 20,000, and its occurrence in prematurity is in about 50% of the cases. And in this type and type 4, which you're going to get into later on, the internal complications may happen, such as aortic and bowel rupturing. In EDS type 1, skin involvement and joint laxity are marked alongside the musculoskeletal deformity and the diverse orthopedic complications. Now, type 2 shares most of these similarities, but they are less expressed, meaning it is also autosomally inherited as type 1. It is also a collagen disorder. Same thing, but it's a milder form. It does not occur prematurely. The joints are less lax, and the skin is less involved in all of these actions. Meaning, they are going to be, yes, hyperextensive and hypermobile, but not to the degree that is worrisome. And the patients may manifest conditions or symptoms, but it is going to be in their late adulthood or their late life, that is. And even if they start acquiring it, if they don't have it inherited, acquiring it during their life, it's only going to be very restricted in a specific area of the skin. And mobility may have extreme restrictions to the point of it having only affection on the hands and feet. Genetically, they are autosomally dominant, as we see in this slide. They are both autosomally dominant, meaning doesn't matter what your gender is. And I'm pretty sure all of you guys know about this information, but still essential for me to repeat it. You're going to have a 50% chance of getting the abnormality if your parent has it. As you may see, here are 5 children or 5 descendants by the father who is affected, and the mother who is not affected. The son that is affected, the son that is not, a daughter that is, a son that is not, and a daughter that is. Out of which 3 were affected, and which their descendants themselves got affected. It's a 50% chance, as long as it's autosomal dominant. I'm pretty sure everyone knows this. And in these kind of diseases, there are always diagnostic criteria, major and minor. And the major in the first 2 are skin hyperextensibility, joint hypermobility, and tissue fragility. And the minor are going to be smooth skin and smoothness of thin skin, muscular pseudotumors. And the muscular pseudotumors are basically calcified hematomas that are over the pressure points, such as knees or elbows. Subcutaneous spheroids, which are cysts that contain fat located over the forearms or shins. Complications of joint hypermobility, muscular hypotonia or delayed gross motor development, easy bruisability, manifestation of tissue extensibility and fragility, such as development of hernia or anal prolapse in childhood, of course, and cervical insufficiency, and surgical complications. Now here is a point. In surgical complications, it's not so rare, and it's not so uncommon in this kind of disease, because there are two types of scenarios that you're going to see in going through the treatment in the surgery later on. And positive family history, it's not a major diagnostic criteria because you can acquire it during your lifetime, but still it is a minor one because it's always going to give you a head start if you know what you're looking for. Now, in therapy, or to say the least, there is no specific treatment, no specific cure for this disease. Unfortunately, that is. But there are some ways to manage or cope with it, such as using the physical therapy. Physical therapy or physiotherapeutic therapy is very focused on balancing out the muscle hypotonia, which is going to essentially help or correct the imbalance that is happening due to the joint dysfunction. And how is it going to be done? It is usually done through light non-weight bearing muscular exercises such as swimming in this case. And some things are to be avoided, as in this particular area, prevention or avoidance. And for example, gymnastics or heavy joint strains are very highly recommended to go against, because putting hyperflexion on or any kind of strain on joints that are very flexible is not going to help the situation at all. Worst case, it's going to make it worse than it actually is. And in surgery, which is always left as a last resort at the end of the way because it is very difficult for EDS patients or people who are affected with it to go through it. Why? Mainly due to two reasons. One, EDS itself induces intolerance to a variety of painkillers, sedatives, and anesthetics. It restricts a very essential thing of surgery. And if it is done under no anesthesia, that's basically torture and very inhumane. And the second reason is that it is not unusual for the original problem, which was intervened for, to reoccur after the operation. That is why it is always taken as a last resort. And there are also, counseling. There is also, counseling. It is very advised, if you know that you have a family history with it or don't know, to go see anyways. The affected first-degree family members should be examined of an intrafamilial variability, and thus the phenotypic range is to be expected should the child be affected when is given birth to. That is to say, if the child happens to be affected by your genetics, in case you have it, you are going to have a head start knowing what's going to happen, basically. The professional is going to ask you, when did it start developing? What kind of complications did you have? What kind of issues are you having right now? So all of these are going to be known prior to everything, so that you can have time to prepare for, and the earlier the disease that is discovered, the better the prognosis is going to be. Now moving on to type 3. It is called hypermobile EDS. It is inherited as autosomal dominant, such as type 1 and 2, and is characterized by major and minor. Majorly here, in this case, it's the joints and skin. Joints being generally hypermobile and skin being hyperextensible, smooth, or absence of tissue fragility. And in minor, there is recurring joint dislocations, chronic joint pain, and positive family history. Family history, we already talked about it, but joint pain can not specifically indicate that it is an inherited abnormality, so it is a minor, but the very frequent thing that should happen is the joint dislocations. It is a red line, or a red flag rather, when it comes to EDS, the joint dislocations. And it is characterized by severe generalized laxity, dislocations, effusions, and arthritis at times. And certain joints, such as the shoulder, the patella, the temporomandibular joint, dislocate more frequently than others. And the musculoskeletal pain in EDS, that is bone deep, is pointed out as early as possible. And as early as the onset, that is, because it's very severe and the patient is going to know it for sure because of how painful it is. And it is usually chronic and sometimes debilitating due to how much pain the patient could be in. Here we may see that here are some very unusually mobile joints. Now, moving on to the fourth type. It is called vascular EDS, or arterial ecchymotic type of Sack-Barbas. It is the most dangerous of all due to the complications it can create. It is majorly due to hemorrhage, basically. Long story short, it's due to hemorrhage, because no way you're going to be able to stop a bleeding that is very abnormal, and there is no actual way of treatment, no actual drugs or pharmacological equipment that could help with this case. And some of its complications are very unexpected for the age that it may have for, as in arterial complications. You never expect aneurysms or strokes in 20-year-olds. It is almost unheard of, if not for this abnormality. It's going to have colon rupture, not so rare yet. It is not very common. Late pregnancy complications, pulmonary complications, and liver rupture. These two may be indicated by the hemoptysis sometimes. And it is an inherited collagen type 3 and has the worst prognosis of all. It does, yes, have some specific facial characteristics, but we're going to go back to that in a bit. The major diagnostic criteria is thin translucent skin, the facial appearance, and the extensive bruising. It has also arterial and intestinal uterine fragility or rupture. Acromegaly, acrogyria, which is the skin that is aging faster than its age, than the actual age. It is due to the loss of extensibility from the collagen, and hypermobility of small joints, tender or muscle rupture, clubfoot, and early onset of varicose vein. This is also a red flag for anyone that knows about anything about the varicose veins. The usual onset is from 40 to 60, if the patient has any. But in this case, in the early 20s, varicose veins appearing on the chest or the legs is going to be showing. And arteriovenous or carotid-venous sinus fistula, pneumothorax, pneumohematothorax, and gingival recession, and positive family history, and the sudden death of a close relative, not so rare, but it could be a red flag as well. A close relative that is young, of course. Now, for the facial characteristics, it's thin, delicate pinched nose, hollow cheeks, prominent eyes, small earlobes, thin lips, or small chin. It's better. It's going to be better with an example. Here, thin nose, prominent eyes, hollow cheeks, thin lips. And here I did mention that there is a clubbed foot, and it is only corrected by surgical procedures, unfortunately. Here are the extensive bruising that you may see sometimes. And the extensibility of the skin in this case is not so much, but still present. And the varicose veins. The gingival recession, if you can see the difference here. And as I said earlier in the video, there's going to be burn-like scars from normal traumas. And this is how it's going to be visualized as. Now, the kyphoscoliotic type of EDS. It has major and minor criteria, majorly being the severe muscular hypotonia at birth, generalized laxity of joints, kyphoscoliosis at birth, that is going to be progressive until it is dealt with, and scleral fragility, minorly being tissue fragility, easily bruising, arterial rupture, or marfanoid habitus, and microcornea. Microcornea, I mean. And it is autosomally recessive this time, and not due to collagen deficiency, rather an enzyme that modifies it, lysyl hydroxylase 1. And this is a pedigree of an autosomal recessive family. Now, we can see here exhibits of the abnormalities that we just spoke about. The hyperextensibility, hypermobility, I mean, the marfanoid habitus, which is basically marfanoid characteristics that are accompanied by flat face or intelligent deficits. As you see, he has very long arms for his age, that if stretched horizontally is going to be as much as his height. Here's this scoliosis, and corrected after surgery, as here, and the microcornea. And unfortunately, really very unfortunately, there is no way to deal with this kind of abnormality, specifically talking about any bone abnormality that it needs to go through surgery for it to be dealt with. And the management in this case is done system-wise. In the musculoskeletal system, it is followed up regularly by an orthopedic surgeon for managing of the scoliosis or kyphosis, and he may need to be restrained to bracing or require surgical intervention at times. The cardiovascular system, the measurement of the aortic root size by the echocardium at the same time of diagnosis by the age of 5 years should be done. The eye, routine ophthalmological examination for the management of myopia and early detection of retinal detachment and glaucoma. And through pharmacological doses of vitamin C, which is a cofactor of lysyl hydroxylase, which may help in this situation by a bit. Arthrochalasia EDS type, and it is basically the dislocation of hips at birth. That is, it's better explained by an example. Here we see a normal right hip. That's a baby hip. And on the right here, the right side, the right, we're going to see that this is the normal location of the hip. It is inside the socket on a 22 degrees. Here, it is dislocated from the socket and only correctable by orthopedic surgery. Outcome is not always satisfactory, and that is due to the degenerative arthritis of the hips and the other joints that most likely are going to develop. As for the criteria, majorly the congenital bilateral lip dislocation, this is a very red flag. It's going to give away this kind of abnormality, and severe generalized joint hypermobility with recurrent subluxations. Subluxations basically means that it's going to be lower than it should be. And minorly, it's going to be hyperextensibility, as in it's always going to be there, tissue fragility, easily bruising, muscular hypotonia, and kyphoscoliosis. And dermatosporadic EDS, finally, is going to have two major criteria: the severe skin fragility and the saggy, redundant skin. As I said earlier in the video, there are going to be signs or symptoms that are more prevalent in some subtypes than others. The skin is mostly involved in this case. And saggy, reductant skin, alongside the minor, which is soft, doughy texture skin texture, easily bruised, large herniae, and premature rupture of the fetal membranes. With an example, it's going to be much more clearer, as in the bruises caused on the pressure points, and bruises caused or happening over the skin for any reason, hyperextensibility, and it is caused by the N-terminal procollagen N-terminal proteinase deficiency, not collagen itself, and it is autosomal recessive inheritance. If you stayed so far with me stuttering here, I appreciate your time, and I wish you a very good day.